This is Miguel Alvarado, CTO at Lumiata. I am here with Aashima Gupta. She's Global Director for Healthcare Solutions at Google Cloud. We're going to be doing a short 5-question interview. Aashima, thank you so much for joining me today. I know that you have a very busy schedule, so thank you for making time for us here.
Thank you for having me here.
Excellent. So let's get started with our first question. How are you thinking about the current crisis? What is top of mind for you and perhaps your business?
So Miguel, what we are seeing definitely from the tech perspective and in healthcare, this pandemic has impacted all sectors of healthcare, be it payer, provider, pharma, all at the same time, and yet very differently. And the needs are rapidly evolving. So how we view of the situation is how we can bring our technology to bear to help the industry and specifically providers. Can we give them tools, technologies, so that they can provide the best care possible to as many patients? And in that, we're trying to be helpful. We are looking into ways in understanding our role as more of an enabler to help providers and people who are in the front line in helping them with the technology.
Got it. And what do you think has been the most helpful? Like, where do you think you guys have been able to move the needle the most in terms of trying to help providers in this crisis?
So when you look into what's that happened, like patients are in the lockdown and frontline workers are either in the hospital dealing with the COVID patients. And as a result, the access to care has been very limited. So access to care meaning people are home. If I need a primary care physician an appointment for my daughter, as an example, she's asthmatic, to be able to connect her with the right care during the time of COVID, where there's a lockdown and kind of outside of COVID, that access is very limited. So technologies like Google Meet, we have telehealth, our health system are leveraging that to make that virtual video conferencing. And the second aspect is patient triage, if you will. Patient triage is our technology on contact center AI. It is built on conversational AI. This is where you can see the application of NLP in a setting where call centers are overburdened. They're getting a lot of questions. So very earlier on, we partnered with CDC. We had a CDC questionnaire. Our sister company, Verily, they put together a very quick COVID chatbot or rapid response virtual agent to allow the first level of screening. So do I have COVID? What do I need to do? So all those are handled right at home, and they're more conversational type. So that we were able to do for University of Pennsylvania and many other, even in the governments as well. And not just in healthcare, by the way, in many, many different sectors where these virtual agents become the first level of triage for that.
Right. No, and that's, I think, an area where AI definitely shines and it can shine even more. Do you think that post-COVID, it's going to be different for spaces like, or technologies like telehealth and chatbots? Do you think they're going to become more pervasive as a result of COVID, after COVID?
Well, I definitely hope so. I was talking to someone, an industry leader just yesterday, and he was saying, hashtag do not roll back telehealth. We have seen, I think some of us, I have a Kaiser background, and having dabbled in telehealth, it's a success. If you look into appointments, we are seeing many of our health systems that we partner with 50 to 60%, 70%, and some increase in telehealth. So a lot of progress in past 8 weeks has happened that was stalled, or I would say very slow, even for if you say, so 8 years worth of work got done in 8 years worth of work got done in 8 weeks. So that's now, I believe patients will get used to it. It's more efficiency saver. And the question will be the reimbursement that the CMS has a new code, the CPT codes. So we will need that advocacy to allow for that, because incentives need to be in place. healthcare is trifecta, right? There's a regulation policy, there's reimbursement, and then there's convenience. In this scenario, all checkboxes are kind of checked.
Right. Well, hopefully we see some refactors around policies and engagements that would have the right aligned incentives for people to continue to develop these things.
Yeah.
So here, let's move to our next question. Well, first of all, we really appreciate you judging as part of the hackathon. What do you think are going to be the things that will be helpful and useful to you as being part of the hackathon? Like, what will be your takeaways from this?
So as I was looking into the submissions, Miguel, what I was blown away by was the diversity of the ideas and diversity of your participants. So congratulations there. I'm seeing some of the initiatives from as like in India and some are in different places around the world, and people are really leveraging creativity. I learned a lot through those submissions, so that itself, it sparks imagination, it sparks creativity. So in that case, I always say collective action is the most powerful resource, and this is where COVID has impacted us all at the same time. So we are having that collective experience. It may not be 100% same for everyone, but we're all in this together and seeing the same experience or same problem, how different country and different innovators and entrepreneurs are solving. They have solving the same problem yet in a different setting and with slightly different constraints was pretty inspiring.
Right. No, that's totally true. I think that this whole situation is bringing everybody together, is making the world feel smaller in some ways, in a good way. It's unfortunate that we need something like this to bring us together. But I guess it almost felt like the world was ready for something like this to bring everybody together.
Yeah, I definitely think so too. Like we needed a pause and a resume.
Definitely. What advice would you give to hackathon participants for the hackathon and beyond?
I think the first advice I would have is oftentimes we have a solution looking for a problem. We already have kind of think of, and we were trying to fit that solution into a problem. Here we have a problem, so it's always starting with the why, always connecting with the problem, and then looking and driving the solution will serve them well. The why of the problem is pretty important. And how do they plan to scale it? Like certain ideas, maybe the why is strong, but when you look into scaling, the cost becomes prohibitive.
Right.
How do you think about taking from that it doesn't become just a pilot, the innovative ideas, and have that kind of notion when you're presenting that this is the idea and how this will scale? I have a joke where I tell like, in healthcare settings, sometimes we have a disease called pilotitis. These are smart ideas, really solve a problem, very hard to scale, requires an entire physician suite to be trained. Like there are constraints in the system. So having that empathy to end user and having the why is important.
Right. No, that makes a lot of sense. Perhaps it would be a good thing for people that want to continue to make a difference in this space, to learn this space better, learn a little bit more about how healthcare works in certain areas, or at least in the areas that they want to impact. Here's an interesting one for you. So there were a lot of kids that participated in the hackathon. We had the youngest participant, I think, was 10 years old. What advice would you send to those people, the people that are in their teens and they're participating in things like this?
Go you.
Totally. To keep doing it, for sure.
Keep doing it. You're inspiring us all. Keep at it. You never know how the dots will connect.
That's right. Very true. Can you share a story from this pandemic that has stuck with you?
Definitely. So I had, being in healthcare for a long time and thinking about digital front door, digital experience, telehealth. We all have been talking about it for a number of years. what this COVID experience has taught me, I always thought technology comes in between a patient and a provider, that it's a barrier.
Mhm.
At times, in COVID, it became the humanizing factor. So we were working with a hospital system, and we saw the use case where people in the ICU and they are where nurses are able to see the patient, but their family members cannot, and they were using the video conferencing for those very difficult moments because they are in quarantine, they're isolated. So technology became the medium to humanizing that experience where your family could see you, right? Those people are alone and they are in isolation.
Right.
In my wildest dream, I could never imagine this to be my digital experience that we always talk about, but this became, and there was another story where people were seeing after the baby was born, they were, and this video conference became the medium to bring that humanized, pretty powerful.
That is super powerful, and it's refreshing because it feels like technology has been creating certain barriers. It's made us a little bit more antisocial. We're in our phones all the time. We can escape to technology a lot of times, and it has been dehumanizing certain things. So I love this. I love the fact that now there's a way to bring it back to technology, helping to humanize experiences.
Yeah, I think that stuck with me and made me ponder.
All right. Well, on that note, we will leave everybody with that thought that technology is returning to humanize experience. I love that.
Thank you, Miguel.
Thank
Thank
you,
you.
Aashima. Thank you very much. I appreciate the time.